Welcome to the American Institute of Healthcare Professionals Videogram on suicide assessment. And this will be a very brief video that just goes over some basic things about assessing a potential individual who's contemplating suicide regarding the lethality and the non-lethality of the actual plan itself. So the first thing to consider is assessing the situation and the individual themselves. You want to be sure to have a good client slash patient history on the individual. You want to understand their current loss or situation. Are they depressed? Are they going through any other type of mental maladies within itself? What is their suicide history within their family? Have other family members completed a suicide? And have they, as individuals, had past failed attempts at suicide in itself? And of course, if the question is never asked, one will never know. Is this particular individual having any suicidal thoughts or ideations about it? And if they answer yes, well, what is the frequency? How many times are they thinking about harming themselves throughout a day, throughout a week? And what is the intensity? How strong is it? Is this a thought that goes in and out, or is it a real intense thought that they feel that their life is going nowhere and that they have to find a way to escape life itself? And bear in mind, at this point, rationality is beginning to leave the mind. No one in their rational mind really wants to kill themselves. No one really wants to commit suicide. This is why the act of suicide itself is now more seen as a act of mental illness, or at least temporary mental illness. So it's very important to assess whether or not it is a low or high risk plan. So what is the lethality of the plan? The more gory the plan, the more intense in terms of harming oneself and how they're going to do it. How detailed is that plan when you think of the lethality and the probability of the plan itself? Are the means available? So if someone is speaking of committing suicide through a gun or a pistol, does the person have access to firearms? That would be a good way to determine low or high risk lethality of the plan itself. So we want to think about, is the individual, how detailed is the plan? How accessible are the means to complete it? And also in regards to the person's ability to conduct it. What is their mindset? What is the probability that they will carry it out? And that's through asking the hard questions of frequency and also the intensity of itself. And also, of course, do they have the schedule and the time to do it? So when you start to assess this, whether it's high or low risk, it's very important to try to make the individual comply to a non-suicide contract. And that simply is them agreeing that if the intensity of the ideations increase, that they're to contact you as a counselor or as a pastor, and to be able to discuss with them why it's worth living. And that's a big step, that you won't do anything unless you contact me. And that's the emphasis of a non-suicide contract. Now, if it's a low risk plan, there's no means to a firearm potentially, or how they discuss how they want to do it. The frequency isn't at a high rate throughout the week. The intensity, the self-loathing isn't there as much. It's a low risk. And you would discuss family support, find out who their support system entails, more counseling. If you're not licensed counselor, to refer them to a licensed counselor. Look for peer support and to find better coping to the problems that are plaguing them. Now, if through your assessment, it is considered to be a high risk, They have availability to the weapons. They're thinking about it all the time. It is extremely intense. There's high self-loathing. They have the time, the place planned. The details are there. They have the weapon. Then it's high risk. It's very important to contact the authorities or family to properly observe them. Usually the authorities are the best way. And this person then can possibly, hopefully, be admitted to the hospital psychiatric branch for a couple days until they are calmed down from this particular thing. And then they can go into, again, the therapy and the counseling that they so much need, whether it's some medication that's given to them or also some cognitive behavioral therapy to help them understand what they're going through, the grief, the loss, whatever has them thinking that they're at the end of the road itself, to help them understand that through coping, that it isn't all over and that there is still reason to live itself. So as I said, this was just a short video on suicide assessment and how to help individuals through it, but also to understand their case history, their background, whether they're low risk or high risk, and what to do if they are low risk or high risk. Our program below is the Crisis Intervention Certification Program, which does have coursework that has the subject of suicide and suicide assessment within it and throughout some of the courses. The link is below. Our phone number is 330-652-7776, and our email is info@aihcp.org. Again, if you're having thoughts of harming yourself, please contact a healthcare professional. And if you know of someone who might be contemplating suicide, contact the appropriate authorities. I'd like to thank you for listening and have a good day.